Hi students, so this week I want to talk about bloodborne pathogens. This is something that every healthcare professional needs to be aware of and talk about because it's something that we will consistently face whether you work in the administrative environment or in the clinical environment in healthcare, okay? It's something that we always need to be knowledgeable of and aware of. Okay, so bloodborne pathogens are pretty much any type of bacteria or viruses that we can be exposed to through the blood. Okay, common ones that are seen in healthcare is HIV, which we will be doing some assignments this week about that. Also hepatitis B. Let's see, hepatitis C is very common as well. I've seen that a lot. So those are some common bloodborne pathogens that we always want to watch out for. Okay, so we always learn and are told what to do to prevent us from being exposed to bloodborne pathogens. Some of those is just like, make sure you wear the proper equipment, make sure that you have your gloves on, your goggles on, things like that. Make sure that you have the proper clothing on if you're in an area that you feel like you're going to be exposed to blood. We know about what to do to prepare, but a lot of us don't know what to do if we actually get exposed. Where do we go next? What is the next step we take if we do get exposed to these bloodborne pathogens? Okay, so I want to talk a little bit about that. One thing that you need to do, the first thing is wash any needle stick injuries that you have thoroughly with soap and water. Not just water, but with soap and water both, to help cleanse that area immediately as soon as you get that needle stick or anything as far as any type of injury that you might get, whether it's with a needle stick or some type of other equipment or something that you're using. You just want to make sure that area that's been injured and exposed, to wash it with soap and water thoroughly, and usually use good, more or less warm to hot water, because it's better as far as with germs and things like that. Another thing you want to do is if the blood has splashed on you, a potentially infectious material has been on your skin, obviously, if it's splashed. So you want to make sure and wash it off very well with water and soap as well, whether the skin has been punctured or not. Make sure you wash it off really good. If there are any type of blood that has got on your clothing, you want to make sure and take it off immediately and dispose of it ASAP in a hazardous area. You don't want to just put it in any old trash can. Make sure you put it in the hazardous trash can area. They always have in the hospital a specific trash can for that. Any type of material that needs to be not touched by anyone, because little kids like to come around hospitals and touch trash cans or whatever. So you want to make sure anything that has a bloodborne pathogen or any type of blood whatsoever is exposed in the proper container. Okay, if you're splashed like around the eyes, because that can happen a lot, you want to make sure and irrigate your eyes with clean, cool water immediately. Saline or sterile irrigations are usually what you want to use, and I usually would recommend that you do that for at least 20 minutes to make sure that you get all that out. The next thing you want to do after you have kind of got cleaned off and everything prepared that way, you want to report the incident. You want to make sure and report it to the proper personnel so that they know that this has happened and you can get the proper treatment as soon as possible. You want to make sure and record the incident as well. Most hospital facilities will have you record this within an incident report, because it's very serious and it's something that you need to make your coworkers aware of. Okay, so make sure that you report that incident in writing as soon as possible. When you report that, you want to make sure and put the date and time that it happened. You want to tell where the exposure occurred at, where you got exposed at on your skin, if there was any punctures, wounds within your skin? Was it just on top of your skin and you just wiped it off with water and soap? You want to be very clear on what happened when you report. Okay, and you want to make sure, last but not least, to seek immediate follow-up care as identified by your employer within the exposure control plan for your facility. You know, the best thing to do is just to make sure you get all that cleaned off, make sure you report it, and make sure you get care as soon as possible. So those are just some tips to let you know what you should do to move forward when it comes to being exposed. You know, because it does happen sometimes. So you just want to be prepared to know how to take care of yourself if that happens. Okay, if you have any questions about this week's assignments, feel free to ask me. Thanks.